When you're using the SCL brief plus mental health, you get to rate 20 critical social emotional learning skills or social skills, five internalizing emotional behavior concerns, five externalizing emotional behavior concerns, and then the parent, the teacher, and the student all rate a common set of five, what we're calling stress indicators. I'll read these to you, the stress indicators, as a student would see them. So the first one is, I worry about things. So when a parent or teacher reads that, it's the child worries about things, or the I statement's gone. The second is, I have stress-related upset stomach and headaches. Third, I cannot sleep well at night. Four, I get easily irritated or annoyed. And five, this is kind of, if you only had one item, this is the one you'd ask. I feel stressed. Okay. So those five were part of a pool of 12 items that were used, and we looked at how well they identified the overall construct of stress and how well they correlated with internalizing and externalizing measures. If you're a student, we ask you to answer five additional questions. Okay. And these questions are about strategies that we're aware of that can help you reduce stress. So we tag these on to the very end. So we're getting a picture of how you behave and function. And now the question is, do you do these things? So these are the five. I control my breathing to relax when stressed. We don't ask the parent that. We don't ask the teacher that. So just the students. I stretch and exercise to feel healthy. I try to get 9 hours of sleep nightly. I connect with friends or family when I need support. And I do a fun activity or hobby to reduce my stress. So, look, that list could have been another 5 or 6 or 7 things, but we know these have a research base as having an effect of lowering stress. And we actually have in the SIP, the class-wide intervention program, and in the SIP T2, a tier 2 intervention program, we have a set of what we call healthy behavior foundation lessons, and they directly address those strategies. They help teach you about stress and ways to manage your stress. They help teach you about social relationships and how to build social relationships. So what we measure about stress and about stress management strategies, that's what we call that second cluster, is actually what we can teach. So the assessment tool is linked directly to intervention activities or lessons, if you wish. If you're an old customer and you're used to SEL and mental health, and if you looked at this, you'd be saying, gee, we ask students to spend probably 2 minutes, 2.5 minutes to rate 10 additional items, five of which we'd call stress indicators, and five of which we'd call stress management strategies. If you're asking a teacher, what's the burden on a teacher? Well, we're asking you to think about this student and rate five stress indicators, 1.5 minutes worth of your time.